Welcome back to Ask the Physical Therapist. I'm here today with Dr. Toussaint Biondi. She's a physical therapist and the director of our Therapeutic Pilates program here at Dancer Shape. If you've been coming to my class or seeing me in class, you'll notice I am not doing a lot of the C-curve positions that we use here at Dancer Shape, and that's because I have tailbone and hamstring pain right now. So I finally decided to go see Toussaint to see what was going on. I'm going to let her elaborate more.
So one of the questions I see in clinic pretty often is when I'm doing abdominal work, when should I be really flattening my back into the mat, and when should I have a little bit of space under my low back? And so we found with Jennifer that she is tending to be a little bit more comfortable right now in the abdominal sequence if we keep her lumbar curve a little bit more supported. And so we're going to use Jennifer as an example of one of these less common modifications. So before we show the exercise, we wanted to talk a little bit about how this translates to your day-to-day. Some people have a bit of a positional bias. They tend to feel a little bit more comfortable, slightly flexed or slightly extended. So if you think about your spine in a sitting position, your spine's going to be a little bit more curved, a little bit more toward lumbar flexion typically. In standing, your spine usually is going to be a little bit more curved outward, and so that translates into lumbar extension. And so in general, we do want to work in a neutral position, but there are situations where we may want you slightly more flexed or slightly more extended depending on the exercise. All right, so this is a demo of how we're going to keep Jennifer's spine a little bit more supported and neutral. So Jennifer, go ahead and bridge up for me. Okay, and then this towel, and then lower down. So the towel's going to go under the small of her back where it feels most comfortable. Okay, and then go ahead and lift one leg at a time. And then let me see a couple of toe dips. Perfect. And so she's doing a really nice job. She's still keeping the ribs in generally. Okay, how does that feel?
It feels very challenging, but it feels better for me.
Good.
Yeah. So,
Guys, if you have any questions or if you're experiencing any discomfort during our classes, you might benefit from an assessment. So please email us at info@dancershape.com. Thanks.
Thanks, guys.
Bye.